Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Welcome back. It is exactly 9:44 a.m. This is News and Views on Salam Media, and we're now going to be talking with Dr. Ismail Mitha. He is the founder of the Gift of Mobility Initiative at Raslouw Private Hospital, and I figure that's somewhere in Tshwane. Dr. Mitha, assalamu alaikum to you. Welcome to the program.
Wa alaikum salam. How are you doing, Julie?
Alhamdulillah, with your duas, doing very, very well. And I must say, I am so impressed coming across this initiative that you have started. Tell us more about it. Well, before I even go there, what is your speciality as a medical doctor? Talk to us a little bit about Raslouw Private Hospital, and then let's move on to this mobility initiative, inshallah.
Inshallah. So I'm Dr. Ismail Mitha. I'm a medical doctor. I've been practicing for over 20 years, and I've specialized in the field of clinical research. I'm involved in the Raslouw Private Hospital, which is based in Centurion, just outside Lodium. It's a very specialized hospital. It's a center for cardiac excellence, and alongside my partner, Dr. Ibrahim, we got the hospital established over the last 2.5 years. It's rebuilt. We commenced building in 2020, and alhamdulillah, we were most fortunate to welcome patients from Gaza. These were little kids who were affected during the war in Gaza, and essentially it's a program which began when I met with Dr. Matt Gilbert, who is also well known to the Salam Media audience. I met with him last year in November, and we chatted about how we could assist. And he said, "Look, as doctors, obviously we are in a very, very good position to be able to offer our services." And, we went through the various sort of kind of assistance that we could offer. And unfortunately, obviously, because it's a war-torn zone, it was virtually impossible for us to go there, right? What he was describing was a systematic destruction of all healthcare systems in Gaza. Today, we've only got one hospital remaining. There were 37 hospitals in Gaza in 2023. And as we speak today, there's only one remaining hospital that services the entire population of Gaza. So there has been, without a doubt, a systematic destruction of all healthcare services. All healthcare workers, specialists, doctors who've been involved in the care of the wounded have also been assassinated. So without a doubt, true to his word, Dr. Matt Gilbert mentioned this last year, there was without a doubt the systematic destruction of healthcare services in Gaza. So
Okay, can I just ask you to take, can we just go for a quick ad break? We'll be back with you in a minute or two.
Sure. Can I take a call quickly?
Salam Media, a global voice for humanity.
The people of Palestine need your support now. Africa Muslims Agency is on the ground, already providing food, medication, and emergency supplies in Gaza. Donate any amount to Heal Palestine at africamuslimsagency.co.za. Africa Muslims Agency, empowering, educating, inspiring.
Shimmer, sparkle, captivate. Nothing less than a masterpiece. Droplets of gold inspires precious design. Platinum bursts with intricate freshness, and every pure diamond becomes more than just a girl's best friend. Voda Gold Gem Jewelers, where timeless dreams become a reality. Come to us. We tailor-make designer gold, platinum, and diamond jewelry. Trade in or remodel your old gold. Clad yourself with classy name-branded watches. We offer insurance valuation and free zakat calculation. Visit us at 534 Ridge Road, Overport, or call 031 208 9142. Voda Gold Gem Jewelers, manufacturers of fine gold and diamond jewelry.
Discover the Africa of your dreams and surround yourself with her spectacular beauty. Relax beneath her serene sunsets and explore wildlife at its natural best. It's where the pride of Africa comes together. The Kwantu Private Game Reserve. Get to know the Big Five or cruise on an elephant safari game drive. Interact with lion and tiger cubs and enjoy world-class halal cuisine while we pamper you during your 5-star stay. Indulge in the true African experience. For reservations, call now on 042 203 1400 or visit kwantu.co.za. The Kwantu Private Game Reserve, the place of gathering.
When the perfect blend of stylish decor, exquisite halal cuisine, and warm hospitality come together, it could only mean Al Bayt Lodge, your true home away from home. Al Bayt is the ideal heaven for families, business people, and tourists with its 4-star family rooms and other luxurious facilities. Conveniently situated close to Port Elizabeth Airport, the beach, and other amenities, your stay will be truly unforgettable, as you'll be taking home lasting memories of the warm hospitality, the serenity and tranquility that Al Bayt has to offer. For reservations, call 041 583 6415 or visit www.albaytlodge.co.za.
Searching for elite local and international investment and advisory services from an award-winning firm? Look no further than the Belmont Mayer Group, your gateway to unparalleled investment and wealth management. At Belmont Mayer, we believe in the art of wealth creation, a meticulous process fueled by our unwavering commitment to excellence. With a focus on providing elite alternative investments and quality advice, we also pride ourselves on maximizing value for our esteemed investors, as seen through our consistent outperformance. Your financial success is our top priority. Join us at Belmont Mayer and experience the difference firsthand. Ready to embark on a journey of greatness? Contact us today. Reach out to the Belmont Mayer Group on 078 786 1698. Call or WhatsApp or email us at info@belmontmayer.com. Elevate your financial future with Belmont Mayer, where every detail matters.
Connect and stay ahead with Salam Media. This is Salam Media, coming to you live from South Africa.
Welcome back. Pardon, it's exactly 9:52 a.m. News and views moving along. This is our final interview of the morning, and we're talking with Dr. Mitha, Dr. Ismail Mitha. He is the founder of the Gift of Mobility Initiative. He is based at the Raslouw Private Hospital, and that's exactly what we're talking about. He obviously met Dr. Mads Gilbert last year and decided that something needs to be done regarding these innocent children that were so horribly hurt and maimed in this genocide. Welcome back to you, Dr. Ismail Mitha. Are you still in contact with Dr. Mads Gilbert?
Yeah, I'm still in contact with him. I mean, he's been guiding us through the process. Look, I met with him again very coincidentally in January in Norway, mind you. And I was on holiday chasing the Northern Lights and
Wow.
chatting with the taxi driver. That's why I believe this whole thing is obviously there was some kind of divine intervention.
Absolutely.
I sat in the taxi, chatting with the taxi driver. And I mentioned Mads' name, not knowing that Mads was living in the city of Tromsø, right?
Wow.
And the taxi driver says, he points out and says, that building there, that's where Mads lives.
Wow.
So and obviously, I reached out. I sent him a WhatsApp, and he responded immediately. He said, "I'll see you tomorrow morning for breakfast." And then the next morning, he met with us, and I remember him autographing the book "One Night in Gaza," and we chatted again briefly about reaching out and seeing whether we can get patients into South Africa, whether we would require any kind of assistance. And obviously, going there was a no-no. There were no hospitals left. There's no running water. There's no sanitation. There's no obviously accommodation for doctors, and there's no hospital. So obviously, going there would really not have been. He bounced an idea of actually floating a flotilla ship filled with medical supplies and doctors, but obviously that was something that obviously we couldn't get off the ground. So I reached out to obviously Department of Home Affairs, DIRCO, various influential individuals, trying to see whether we could, get the program off the ground with the assistance of government. But unfortunately, it wasn't to be. Everyone was at that time, immersed in the election campaign, and obviously it was something that really, we were not winning with. And then, I flew to Palestine in May of this year. I met with an organization called the PCRF, the Palestinian Children's Relief Fund. And now, obviously, wearing my meal cap, we signed an MOU with the PCRF, wherein they would bring the children of Gaza, the war victims, into South Africa, and then we would treat them at the Raslouw private hospital. So you see, essentially, we entered into an arrangement, which obviously proved a lot more difficult than it sounds, and effectively, the logistics was actually firstly selecting the patients, because there's over 1,000 patients that require medical and urgent surgical intervention, right? They're all waiting to go somewhere, and PCRF are conducting this treatment abroad program. So they would fly the children to the US, Italy, anywhere in Europe, literally to any country that puts up their hand and says, "Listen, we can help." So as obviously as a South African and as a proud South African, being involved in the ICJ court case, bringing the genocide case against Israel, obviously South Africa was probably the most appropriately placed, right, to welcome these patients into our country. So, after lots of to and fro, May, June, July, towards the end of August, we accepted our first patient. That was Mira, and she had explosive injuries to her right leg with multiple fractures. She required plastic surgery and rehabilitation. And, upon arrival, she was accompanied by her mom and her dad. And, their story is as tragic as the next story. And, I mean, you just start to tear almost immediately when you listen to their story. The second child, they got nowhere to go. I mean, their homes are under, they show us video footage. Their entire lives, right, gone and immersed under rubble. You see it on their phones, on their WhatsApps, when they're communicating with the people and family members that remain in Gaza. And they left 2 other children in Gaza and had to select from their 3 kids who was requiring the medical or treatment that was more urgent, in a sense. All right. So they had to select from their 3 kids, and they had to choose that, okay, Mira needed the treatment more than the other 2, unfortunately. So it was obviously heavy-hearted. They had to depart, leaving the other 2 kids behind. And then came Lina, like almost a week later, and Lina had also an explosion injury, and she had a fracture of a hip, which had developed into what we call avascular necrosis or bone death, right? And she required it, right? And shukr alhamdulillah, last week we saw Lina and her family depart, and she walked out of the hospital And alhamdulillah, that was, a wonderful, rewarding experience in actually seeing this gift of mobility program in action. And
Subhanallah.
yeah, it was extremely sad because they can't go back to Gaza, but they flew back to Egypt. And and then the third child followed very shortly thereafter. That was baby Sinad. And baby Sinad was probably the most heartbreaking, tear-wrenching case. Little 1.5 to 2-year-old baby who was afflicted with white phosphorus burns.
Oh,
And
no.
to this day, the child is still in our hospital, has had already a surgical intervention. And alhamdulillah, is progressing well, but is still experiencing new burns every day. So this child
Sure.
was exposed, right, to the white phosphorus 10 months ago. And to this day, every single day there are fresh new burns. So
Oh, no.
he just screams out in pain, and you know there's another burn coming out, and then you see the a short while thereafter, right?
All
And
right.
there are multiple blisters and new burns that are coming out, and the entire inside. So whatever we're seeing on the outside is also happening on the inside. So baby Sanad, alhamdulillah, stable, doing pretty well. We've had multiple, there are multiple surgeries planned for him. One surgery or one surgical intervention was completed 2 weeks ago. So alhamdulillah, he's doing well, he's stable, and he's learned to walk, and I call him the Prince of Raslouw Hospital. You see, up and down the corridors of the Raslouw Hospital. So look, alhamdulillah, the program has been successful, and we are planning to welcome baby Wasim, who is going to arrive probably in the next week, inshallah. And then, obviously, there are other patients whom we've selected, but it's not easy because the thing is, you select the patient, and then the paperwork is not in order. They don't have passport. There's no home affairs. There's no departments of education. There's no Department of Health is non-existent. So you can't actually issue a birth certificate. Passports are difficult to be issued, and a lot of these children don't even have documents, right? So you may, the thing is, we have a panel of doctors that actually look at the various cases and say, okay, we can assist this child, and then obviously.
So can I interrupt you here, Dr. Mitha? Can I interrupt you here? I'm just kind of thinking about the logistics around all of this. It sounds absolutely ginormous. I'm kind of thinking, so where are these children placed? Where are they living in Palestine? Who identifies? You obviously have a man on the ground in Palestine or Egypt or at the camps.
Our man on the ground is an organization called PCRF, so Palestinian Children's Fund. It's probably the largest aid organization in Gaza on planet Earth. And I mean, we are currently experiencing, obviously, with this genocide happening in front of our eyes in time, right? What is happening is that you have the largest amputee population on earth sitting in Gaza. And that is one of the reasons why we reached out to PCRF and said, listen, what we want to do is, as Mitha is an aid organization in South Africa, right, which was born in 2020 during COVID, and we provided 1 million tons of mini meal to people who needed food at that time. Remember, at that time during lockdown, shops were closed, grocery shops were closed, and the rural areas were not actually accessible in terms of obtaining nutrition and food. So we supplied during that period about 1 million tons of mini meal, and we partnered with various aid organizations in South Africa to provide those mini meal bags to people who needed it, specifically in the rural. And we supplied the food banks and various organizations with our mini meal at that time. So, we've continued, and obviously, because there was this link between Meal SA and PCRF, through the individuals in each of these organizations, we were able to actually successfully conclude an MOU to bring these children into South Africa.
So in terms, so they PCRF would identify the children, make contact with you, and then send the kids. Once you get the paperwork all sorted out, then send the kids. How many of these children are you able to assist on a weekly or a monthly basis? I know up to now you've mentioned 3 or 4 children, and I know there must be, apart from you, lots of other healthcare professionals involved in the rehabilitation, the medical help, the operations, etc. Everything. It's a multidisciplinary approach, so there are lots of other people involved. How many children are you able to assist on a monthly basis? And I know you also have a life, and all of you have other responsibilities as well. And I just commend you guys for going this route. But how many kids are you able to assist?
So look, the thing is, I think we are able to assist as many as we can possibly, right? Unfortunately, we are restricted by the flow of patients from Gaza, Rafah, and Egypt. So effectively, it's an incredibly difficult task to bring them across. So PCRF handles those logistics. They actually select patients who have documentation, who are able to travel. So I think essentially, like I mentioned previously, the treatment abroad program is something that they are quite specialized in, and they are currently treating or having patients treated in the US, in various countries in Europe, and obviously in the Middle East and in South Africa. There are patients who are being treated in Australia. So they have quite an established treatment abroad program. And I mean, the thing is, ultimately, what we wanted to do is essentially just try and see how the process works. We've got the community in Lodium, who've really, really come forward and taken care of these children and their families, whilst the kids are in hospital. So that also is a huge amount of responsibility. Remember,
of course,
it's the accommodation, it's the food, it's the lodging, it's transport to and from the hospital daily, right? And visiting hours to and from the hospital, the transportation and logistics. So it's an enormous responsibility, and I'm immensely thankful to the community of Lodium, Raslouw, Elderglen. Though they've just come, to the hospital and really been absolutely generous in every way, when it comes to giving their time and really taking care of these individuals. So alhamdulillah, we look forward to welcoming more patients. Essentially, it's a collaboration between Meal SA, Raslouw Private Hospital, and PCRF, who enable and facilitate the transportation and safe passage of these patients across into South Africa.
Okay, so I've got to wrap up now. Dr. Ismail Mitha, founder of the Gift of Mobility, in partnership with Meal SA, and then on the other side in Palestine we have PCRF and a whole host of other role players, as you've mentioned, the absolutely big-hearted, wholehearted South African Muslim community that are doing everything they possibly can to assist in any way they can. But for people listening to us this morning and want to be a part of this initiative, want to try and do something, want to maybe make a monetary contribution, where and how do they go about doing that?
Look, the thing is, our banking details are provided. So all expenses in South Africa are carried by Meal SA. So essentially, you can pick us up on the various social media platforms, and the banking details are provided. Remember, it's all zakat contributions. Our people are, they don't really have anything left. And it's actually tragic. The thing is, they have to go back, but they've got nowhere to go back to.
Sure.
They don't have a home. So it's like, you look at Lena and family really went back. They've got no house. They've got really nothing, but obviously she's got her other family members who remain, and that's what she's traveled back to Egypt for. So it's a desperate human disaster. And, all we can do is make dua that Allah somehow or the other provides relief and comfort to these people.
Amen.
When you actually see it firsthand, and to experience those phosphorus burns on that child and to see it every day, you realize that this is it's a human catastrophe.
Anyway, we've got to wrap up. Dr. Ismail Mitha, you are the founder of Gift of Mobility Initiative. And of course, there's a whole host of other role players involved. We salute you. We make ongoing dua that Allah subhanahu wa ta'ala bless you guys in every way possible to continue helping and healing as many people as you possibly can. I think this is truly work of the highest of order and nobility. Allah accept from all of us, inshallah, particularly you and your team. Continue doing the amazing work, and hopefully we will be talking some more in the future. Continue doing what you're doing. You are making a positive difference in the lives of the most destitute, the most downtrodden of people due to this genocide. So Allah accept all of your efforts, inshallah. Thank you for talking with us, and keep on doing the amazing work. Keep on creating miracles in the lives of these people who have absolutely nothing left. So shukran very much to you.
Shukran, Julie. Jazakallah. Thanks to the Salam Media team for hosting me this morning. Alhamdulillah. And let's continue praying for Gaza.
Ameen. Thumma ameen. Assalamu alaikum and Khudafiz.
Wa rahmatullahi wa barakatuh.
It is exactly 11 after 10 o'clock, and that means a wrap-up time. Thank you indeed for being with us on the show this morning. And we've had some amazing people sharing some amazing stories with us on the on online radio today. Let's just salute them. Let's just continue making dua that the madness stops, that Allah subhanahu wa ta'ala puts into plan the emancipation of our brothers and sisters in Palestine, and continue blessing us with people like Brother or Dr. Ismail Mitha and his team, and all the other role players around the country and around the world. Meal South Africa and the most generous and open and big-hearted Muslim community in South Africa. Allah continue rewarding you in ways that you never imagined possible. Till tomorrow morning at the same time as always, thank you for being with us. Assalamu alaikum and Khudafiz from me, Julie Ali.